Okay, so this session is kind of like revision session ataupun macam refresh your knowledge and also your kind of like technique for developmental milestones. The problem is the biggest challenge is doing developmental milestones assessment online, which is a very difficult one. So and plus with the COVID situation at the moment, we don't really have passion to assess. So that's the difficulties. The thing is, we've given you the lectures when you are in year 3, so it's kind of like the same lecture that I'm going to go through again. Um, and obviously, I'm not going to bore you with the same lecture 2 to 3 hours information. It's just that try to get you to the a bit of tips how to do it. I'm going to show you some videos. These videos is just a YouTube videos that you can find. It just try to get the get the gist, the feelings of doing developmental milestones in children. And we really for your Finder Pro, we're not going to give you a very difficult one. Most of the time, we give you a normal child. Most of the time, okay, because a normal child you can do more things compared to the abnormal child ataupun yang disabled child. So most of the time you get a normal child. The thing that we're going to assess you when you do the developmental milestone is whether you know how to do it or not. So that's the main thing. Um, but most of the time, because we need to variety kan kita punya passion in the Final Pro, most of the developmental milestone passions will get bored because none of the examiners will bring you to that station. So that's the situation, and because normally they're not really interested to see developmental assessment. They will go to cardiology ke ataupun nephrotic ke ataupun neurology case. So itu yang selalu berlaku for the past 2-3 years. So we will prepare the passion for the developmental milestones, but normally the examiners don't really assess developmental milestones. Okay, fine. The first thing I'm going to show you is, let's see videos of how to approach infants and also children when doing a developmental milestone. The most important thing is you need to understand what is the task ataupun what is the instruction you'll be given. So you'll be given normally 2 domains together. So you have 4 domains. You got fine motor and vision. You got gross motor. You have speech and language, and also you have the social skills developmental milestones. So normally we don't really ask you to do 4 domains all together, because in your final pro normally you will be given 10 minutes each session for the short cases. I don't know whether Prof. Mazuki already briefed you on how is the final pro going to be conducted, because have you guys been briefed of your final pro?
Yes, Doctor.
Yes, kan? Yeah. So there might be changes. So you might probably we call it modified long cases, but but I think once we start with your clinical attachment soon, hopefully next week, and then we can kind of doing more and more practice about a modified long case, obviously with the other lecturers, because I'm not going to be here anymore. But I'll be doing the online teaching with you guys. Okay, fine. Let's see. So because we're doing the modified long case, okay, so it's going to be unlikely for the developmental milestones to be assessed. Okay, so you'll be you can breathe a big relief sigh, and rasanya ni semua pun rasa happy and not doing developmental milestone, betul tak? Yeah. So everybody seems to be smiling as well, which is good. Okay, don't need to do the milestone. Yay, that's fine. It's okay. I'm sure Aklan also happy as well not to do it. Okay, fine. But obviously you need to have at least an idea how you're going to do it lah. So I'm going to show you these videos, just a simple one. Um, let me see. Where is the one? Okay, let me try to share this screen. So it's just the way how to do a fine motor. Um, I just want you to see in terms of how these candidates approach a child, and then before he approaches the child, he need to get the information and also need to understand the instruction from the examiners before he start doing the assessment. Let me know kalau sound tak ada. Can you hear the sound? Yeah. Okay. Okay, so basically, you need to make sure that you are clear with the instruction. So the instruction is very clear. The examiners want him to assess the hand function ataupun fine motor. So in this case, he's just going to do one domain only. Okay, and obviously with one domain only, in a 10-minute sessions, you need to kind of like try to guesstimate ataupun guess and estimate the child age so that you know where to start. Okay, so what he did just now, he was basically um, introducing himself. Okay, introducing himself, and then basically try and then identify the passion. So make sure you know it's like you are introducing yourself and try to engage with the child. Obviously, this child is a big child. She's probably about three years old by looking at the size. So from there, you kind of like knowing where to start. 3 years old in term of developmental milestone for the fine motor, you probably can think about how many blocks that she can put on in terms of what kind of whether he can do straight lines, circles, the triangles, and so on. So by looking at the age, and then by conversing with her first, means that if she starts a yes, no, so from that conversation, you kind of knowing what age is the child. For example, if you see a child umur macam ni, this size, and then she was talking like 3 to 4 sentences, so you can put that her speech and language probably about 3 years old, and then from there you can think of possible that the fine motor skill also about 3 years old as well. So you can knowing where to start. So let's get on. Yeah. So 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 normally when I teach you guys about fine motor, so what normally I taught you guys what you should do first.
Hands.
Okay, so normally I taught you guys to start with the cube first, kan? So from the cube, it's quite easy to know with the cube. And then the cube, if they can do more than 10, then they are more than 3 years old. If they can do 3, 18 months old. About 6 is probably about 2 years, and then 9 is about 3 years. More than 9 is more than 3. So that's how the way that I approach my fine motor skills. So I normally go for cube first. But it doesn't make everybody should have their own way of assessing. But the way that I'm trying to teach you is you need to go by doing blocks. You can make knowing what as where to go. If you want to move from blocks to pen and paper, so kalau pen and paper tu, if you already got a child that is more than 3 years old, so you don't need to ask the child to do a vertical line. You probably can ask the child to do a square straight away, circles immediately instead of doing the vertical line. So those are the things. And if they can write, you can ask them to write A, B, C, and so on. Okay, so that's why I normally go for blocks first, so that I know where they are in terms of their fine motor, and then from there I kind of know where to go for the pen and paper, and for scribbling or mainly scribbling or writing and so on. Okay, so before that, he asked the child to pick up a crayon or pencils, and then once the child pick up the crayon, and then he asked the color. So at the same time, he's not really assessing the fine motor saja, and he's also assessing possible speech as well. Okay, at the same time, he's asking the child to do shapes and so on, and then the child can scribble and doing things. So at the same time, you are also assessing speech as well, or understanding. Ini tak clear sangat. So she's doing the cross as well. Okay. Okay. At the same time, you need to assess, or need to observe the way that she's holding the crayon as well. So what kind of graphs is that? So you got multiple graphs that So you got the cylindrical graph, which is pegang pencil. Yeah. So cylindrical graph, which is holding the pen like that. Okay, and then you got the digital graphs, and then you got a modified tripod, and then you got a proper tripod after that. So normally most of the child yang pegang digital graphs ataupun cylindrical graphs ni normally about 18 months to 2 years old. The more than the digital graphs is 2 to 2.5, and about 3 sometimes 2.5 they dah boleh start with the modified tripod, and then 3 they should be able to write to hold the tripod properly. Some children develop modified a mature tripod at the age of 4. So it depends on the patient. But in this case, she's still holding the pencils, with the cylindrical ataupun yeah, it's a cylindrical graph. Don't be frustrated if the child does not follow you. So it's okay. You probably push once, you probably push twice. Kalau the child does not want or cannot do it, then that's fine, because that's the limit of the child, and so you don't need to push further if they're not doing it. Everybody okay? It's a bit difficult to do developmental milestone macam ni, because I cannot see. I don't know whether you can see. I don't know whether you understand or not. But well, this is the best that we can do for the time being lah. Okay. No question so far? Okay.
How about bricks?
Okay. So he's gone for bricks now.
Is that making towers? Okay. Do you want to show me how a tower you can make? Okay. Okay. And a very good secret, haven't you? 3 blocks.
Okay, 3 blocks, 4 blocks, 5 blocks. So and then look at her. She's always trying to adjust the tower, because she understands the concept of base. So if you understand the concept of base, which normally happen from 18 to 2 years old, then then they normally can do much higher and higher tower.
Should we try some more shapes? Do you think if I take your tower, would you want to knock it down?
Okay, so at the moment she's doing 7. So 7 is about 2.5 lah, or more than 2. Okay, so I'm a bit surprised that this candidate does not go further. So I would probably ask the child to do further and further, and see what is the tallest tower that she will make. She can make. Okay, so she's doing the kind of like train, which is not really a train there, and doing the bridge. So bridge. So what age you expect a child to do a bridge?
4 year old.
4 years old.
3 year old.
3 years old.
4 years
3
old.
years old.
It's a bit late lah. So about 2.5, 3, 3.5 lah kalau paling lambat pun. Okay.
How about if you could take this down to make a train? I'm going to show you one thing. It might be a little bit difficult.
Okay, so in this case, because I think the child probably about 2.5, 3 years old, what he's doing was he's showing the child what. Okay, so asking, showing the child to do the bridge, showing the child to do the train as well, and then ask the child to copy what he's doing, which is okay for this age. If you think that the child is more than 3 or more than 4, you probably test their understandings, and after that testing the fine motor. So asking them to do bridge, asking them to do train by just wording rather than demonstrating to the child.
What we're going to do is we're going to make some stairs. We can make stairs like that. Good job. Is that Daddy? Oh. It's my daddy. It's your daddy. Yeah. Okay. Do you want to show Daddy your bricks? What are you making with bricks? Yeah, I can see that. Yeah, bricks. Okay, should I tell you what? Should we move on? Do you want to show me? Should we show Daddy how good you are at threading things?
So it looks like she's not doing the steps. But what age do you expect a child to do 6 brick steps?
4 years old.
Okay, so about 3.5, 4 years old, and so mainly by 4 they should be able to do 6 brick steps kan, ataupun 3 steps more than 4, about 5 they should be able to do more than that about 8 brick steps ataupun 4 steps. Okay, so once you do that, and then you go for some sort of functional. So functional could be buttoning, it could be the thread, ataupun scissors, there's not much in terms of steps from here, but normally go for thread and button ataupun thread and bead. You can go for scissors after that, and then carry on. So let's see what he's doing. So ada string, ada thread, and then you got the kind of like bead or something with the hole, so that they can pull through the string into the hole. Okay, so you don't need so many things. Just one demonstration pun dah cukup lah. You don't need to ask them to do a proper anting-anting ke, a proper proper bracelet kan. So just one thing, should be enough. Okay, so you don't need to do. You don't expect in 10 minutes. You don't expect her to do a proper bracelet nak pakai and so on. Macam kau nak buat kat rumah lah kan. Craftangan for the past 3 months PKP. I don't know whether Aklan doing the same thing or not. But you know, just one small one demonstration that she can pull a string into the beat. That's enough. If your child looks quite enthusiastic and want to do more, then you can let them do more. But the thing is, you just need one for demonstration untuk demonstrate the fine motor skill for that particular task. Then you go for scissors, and then make sure that you got safety scissors, not the scissors yang kau pakai, yang adult pakai, not the scissors that you use in your kitchen, not the scissors that you use for hair cutting and so on. Just the safety scissors, that's enough. Okay, so this is what the menu asks you. So at the moment, it's just cutting, just cutting anything. So not cutting a shape, not cutting pictures and so on. Just cutting. The thing is, you need to assess whether she can hold the scissors properly or not. Okay, looks like she's probably not holding the scissors properly, because the first time she holds the scissors is not a correct way to do it, to wear scissors. And at the moment, you know, she's still struggling to wear scissors. So you need to assess the way that she do scissors. So she's not showing sign that she can hold the scissors. Yeah, macam nampak tak kan? I don't know. Can you guys hold the scissors? Where? Okay, anak mak ke anak ayah? Yeah. Yeah, you can hold the scissors, which is fine. So make sure that the child hold the scissors. Kalau dia memang tak boleh pegang langsung, the way that she hold it very very difficult, it's not correct way, means that she's not going to cut the peppers. Okay, because the way to hold the scissors, there is order that you should be just put 2 fingers and then one on the thumb, and so those are the correct way. If she's not doing that, then there's no point proceed with the scissors. Okay, and then what you do after that is just try to do a functional fine motor, which is either buttoning or flipping the books normally. Okay, and then flipping the books, you really want to know how many pages she can flip. Okay, so that's it. Okay, in this video, they're asking about how you could present your finding. So in this case, normally how I said to examiners is, so So I've been asked to assess the fine motor development for this child. If you know the child's name, you say the child's name. So and then you go through what have you done. So what we do is if you start with the pen and paper, you say that the child can do circles, the child can do cross, the child can do square and triangles, and then I proceed with the cubes. When I asked her to do a tower, she can manage to do a 7 blocks tower, and then she can do the bridge, she can do a train. So that's probably keeping her with about 2.5 years old developments. However, why I say 2.5 years old is because that she can do the bridge and train, but she cannot do the three steps ataupun 6 brick steps. Okay, and then you go for string and bead. So she can thread through the string to the bead. However, when I asked her to do scissors, she's not able to hold the scissors properly. So putting things together, her developmental milestone for the fine motor is about 2.5. Normally you can go for range, so 2.5 and 3 years old. So cuma janganlah more than that. So normally you give 6 months punya range lah. Janganlah bagi 3 to 4 ke ataupun 3 to 5 ke. So normally you give for 6 months punya range. Itu untuk budak-budak less than above 2 years old. If they're less than 2 years old, normally you go for 3 months range. So 6 to 9 months, 9 to 12 months, 12 to 15 months, 15 to 18 months. So 3 months punya range. Okay. So is there anything else you want to include in your examination? So normally I would say if this is the question from the examiners, normally you say that you would like to assess the rest of the domains, including the gross motor, speech and language, and social. You also would like to examine the full examination, cardiovascular, respiratory, GI, CNS, and so on. Okay, and then what is the developmental milestones as I suggested to you just now. Okay, so those are the way that you do kind of like doing a fine motor, which is for me is it's quite simple lah, and it's quite straightforward as long as you know what to do next. So and just follow the way that you are comfortable with. But normally you go for bricks, pen and paper, you go for thread and bead. Sorry, string and bead. You go for scissors and you go for function after that. So function could be anything like buttoning your shirts, flipping the books. So those are the things that you can try. Okay, so that's fine motor. Okay, that. Okay, then let's see another videos. Almost the same kind of instruction, but this one. I think they add on one more task. Okay, it's still about 10 minutes punya assessment. Yeah, let me share again. So far semua ikut Semua ikut? Because I don't really have audience.
Can I ask a question?
Yes, you can.
Regarding the fine motor, I just want to ask the difference because in PITS protocol it said that in the age of 3 years we can copy the circle. Sorry, no.
Copy ni.
Imitates the cross,
yes,
but for the 4 years can copy the cross. So what is the difference? The imitates and the copy.
Should be itulah kadang-kadang tu apa dah? PITS protocol dia tak properly saying for me copy and imitate is the same thing. Okay, cuma imitate is imitate is 3 years old kan, copy is a 4 years old kan, betul tak? So imitate is you show into them, you demonstrate to them the cross, okay, and then they at the same time seeing you doing the cross. Copy is basically you don't show them the cross. Bila korang lukis cross tu, you basically block their view when you're doing the cross. Okay, and then you show the end product already for them to copy. So those are copy. The imitate is they need to imitate. They need to copy the movement as well, doing the cross. So, but the 3 years old need to see how you're doing it. The 4 years old can basically just copy without seeing how you're doing it. So those are the difference between imitate and also copying. So that's why in this particular case, just now yang video tadi, that person, because he kind of knowing the age, kind of like can guesstimate the age. So that's why everything that he shows in terms of circles, the square, the triangles, he basically show to the child how to do it, so that she can imitate the shape. Okay.
Thank you, Doctor.
Okay, next one. So it's almost the same. So I'm more focusing on the fine motor here, because actually fine motor is much more senang sikit nak buat in your exams. Obviously, the gross motor easy to do it as well. However, the equipment that we have is not many lah. Sebab kalau macam gross motor ni nak tengok, kalau dia besar sikit nak tengok dia boleh jumping ke tak, dia boleh naik tangga ke tak, dia boleh main basikal ke tak kan. So normally we don't really have a bicycle to bring for the child to be assessed, and we can have a balls, but we don't really have other things in terms of equipment to assess. So that's why fine motor is much easier to assess. Okay, let's me. Okay. Right, you guys can see it?
Sure.
Okay. So,
Hi, Basimas.
So speech.
Hello.
And also fine motor.
Is that your mummy? Hiya, Mum. Gary's my name. Is it okay if I test Basimat's development today? Thank you very much. Do you want to play a game? Yes, of course you do.
So see in this case, he probably know that this particular child, Basimas, is not really going to speak to him properly ataupun understand his instruction. So he basically getting the consent from parents and telling the parents that he's going to do just say developments ataupun you say nak assess ataupun nak nilai dia punya percakapan dan juga dia punya motor halus dia. So those are enough things to say to parents. You don't need to do anything else. In a very layman person term, is playing with them. So it's probably one of the way that you can say as well. But a proper way to say it, I would like to assess. Saya nak nilai dia punya percakapan dan juga perkembangan motor halus dia. So which is fine enough. You don't need to go through very detailed minute thing. Let's say nak cakap saya nak assess dia punya motor halus dia, saya nak tengok dia boleh tak buat main dengan cubic, main dengan cube, main dengan pencil and so on. So those are quite complicated. So those are the very simple way to do things.
I'm going to ask you some funny questions. We put these here. Oh, and thank you. I nearly forgot about that bag. So, can you point to where your mummy is? Oh yeah, thank you. I forgot my car.
Plastic.
So, can you show me where your mummy is? Where is she? Can you show me where she is? Can you point at her? Where is she? Where's your mummy? Where's Basimas? Do you want to play a game? Come on over here and we play a game. Okay. Can you tell me which one? Can you tell me which one is the duck? Where's the duck?
So he's doing this
well
speech assessment first.
You're very good
okay?
at this game. You know that. Can I see the duck? No. Can you hand the duck to me, please? Oh, thank you. You're very good. And can I have those back? Pretty, please.
So the child seems to know the objects.
You give me all those back.
And at the same time, what he's doing is he's trying to assess first step or one step in instruction. So one step instruction, like giving me the objects, can you jump for me, or can you close the door? So those are just one step punya assessment atau one step instruction. So that is what he's doing in the moment.
Well done. And which one is the spoon? Which one of these is a spoon? Well done. Can I see that? Okay. So which one of these do you eat with? Which one? Azamin.
Okay, so at least when you ask them to name objects, you need to have 3 different objects which are not related to each other. For example, you don't want to have spoon and fork together, or spoon and plates together. So something is totally different. So in this case, he has a spoon. I think that's the pink one, probably crayon. The other one is duck. And so 3 different things, 3 different irrelevant ataupun not connected to each other. Okay, so that's the most important thing when you come to the naming thing. So what age that you expect them to start naming objects?
This 2 years.
Okay, anybody else want to say any other age? Okay, so naming objects is basically about 2 years. Okay, and then about 2.5. Basically, they got the cognition or understanding what is the object used for. So he now already know that the child can name objects ataupun can identify objects, but now he wants to see whether is she 2 or is she 2.5, ataupun is she more than 2. So that's why he's asking about the purpose of the object. And
do you want to finish the game, Batimat? Yes. Oh, thank you. Which one of these do you eat with? Oh, well done. You're very good at that. Wow. Okay.
Okay, so she can she's like more than 2.5.
We're not finished our game.
Well, more than 2.
Do you want to come back and finish the game?
Because she knows.
Come on.
We used to eat.
Oh, well done. Okay. Batimat. Oh, she's very, very good. Okay, I think.
And obviously be patient. Okay, be patient. You won't see a child that will sit down and not going to move. You will see a child, especially at this age, 2 and 3. We call it terrible 2 because they don't really stay static. Okay, I'm sure that you also don't stay static as well. Have you? Yeah, I don't think you stay static. So be patient with them. You can try to push multiple times. The thing is, play with them. So and try to attract, try to get their attention. And you need to do things that benda yang korang akan buat lah, tak kisahlah. So but bring yourself to their levels, okay? Because at the end of the day, you don't want to say to them that kita akan uji. No, we're not going to say that. We're going to say that kita akan main. We will play. We're going to play with you. So those are at their levels. So when you say we are going to test you, we're going to assess you, you're not going to catch their attention. So the words that you're going to use need to be at their levels. Okay, do not use for you guys. Obviously, I can say that I'm going to assess you. I'm going to test you, which is fine. But if I say to you guys, I want to play with you, it's just not right, isn't it? So same as the child as well. If you say to them that I'm going to test you, it's just not the right wording that you use for their age. But you say, I will play with you. We're going to play a game, and then that's more suitable to their age. Okay. Well, obviously, with Aklan, I can play football with him, but it's okay, which is fine. But in a child, it's just not the right words to say that I'm going to test you and so on. Okay.
Do is going to move on to find.
So he finally give up. Okay. He said he's going to move on to something else. Okay. So obviously you have time. So you got 10 minutes. You need to make sure that you try to finish your task. Your task is try to assess the speech and also the fine motor. So do not spend too much time if the child is not going to comply with you. Okay.
Let's play some games here. I see, Matt.
So now he's going to move to
Look at these bricks. Look at the bricks. Can you show me? Can you show me how to build a big
so
tower?
he's going to move to the fine motor.
You show me how you build it. Close, nearly. Go on, show me. Come on, you want to win. Well done. That's it. Well done. All right, showing off now. That's it. So, 6 bricks.
Okay.
Wow. And Basimat, can you do this? What? What's on it? Oh no. We leave that alone. That's hiding. It's asleep.
So good. So that's fine. It's just a behavior thing. So I'm sure that you guys probably spend your time in the tumble dryer ke ataupun pernah masuk mesin basuh masa kecil-kecil kan. So then doesn't matter. You just need to bear with her because that is part of being a child. The main thing is try to be patient with them and try to try to gain their focus to you and then make it interesting lah. What he was doing just now, he put the bricks up, making the tower, and then he basically pushed it down himself. So he basically tried to attract the child's focus and concentration, trying to do those things, and then what Basimas did was just now put 6 and then she kind of like destroyed by herself. Okay.
Can you build a bridge? Can you? Like this. Look. Oh, can you do that? Oh wow. You're very good at that.
Okay. Fine. That's fine.
No.
That's okay.
Basimat, look. Oh, look at this. Look at this. Can you draw me a picture? Can you? Look here. Can you draw any pictures? Can you draw a picture?
So the other thing is make sure that you give in one thing at one time. Faham tak? So if you want to move from blocks to the pen and paper, make sure you hide the blocks. Bring the blocks away. Get rid of the blocks. Okay? Oh, aku lama seorang. Get rid of the blocks. Okay? So when you get rid of the blocks, so that the child can focus on one particular task. Okay? If you bring the pen dengan paper ataupun kain dengan paper ni, at the same time ada juga benda lain, ada juga cubes, and then you basically make them confused what actually you want them to do. So if possible, before you bring new things, get the previous things away from them first, hide them so that they can focus on one particular task. Okay, at the moment you can see that he's clearing up the cube so that the child can focus on the another task.
Go on. Oh no, that's eating it. Is that nice? That tastes funny. Yuck. Ew. Can you draw any pictures? Can you do that? Can you do that?
Okay, so as I said before, always see and observe how she holding the crayon. Okay.
Do this.
It looks like this child has not got any hand preference yet.
You're very good at that.
So
Well
hand preference. What age you expect a child to develop hand preference? To 18 months then. Okay, 18 months. Do you think the child is 18 months? Basically she looks older than that, and plus the way that she talk, she's probably more than 2. And but it looks like, you know, she's still when the candidates ask her to draw or do things with a crayon, and at one time she's holding with her left hand, and the other time she's holding with her right hand. It looks like she's not really developing the hand preference yet, which is fine at this age. You don't really say that the child, you expect a child can start developing hand preference by 18 months, but you can allow them to up to 3 years old. The thing is, you start to worry if they develop hand preference before the age of 18 months. So those are the worries. But if for them to develop more the hand preference more than 18 months old, up to 3 years old, then that's still in the normal variance. If they don't have hand preference by 3 years old, however, they still can function with a good fine motor, can write with a good skills, with a proper, possible modified punya tripod on both hands. That probably okay, because their function, their developmental milestone is up to age at the time, despite them not really having the hand preference yet. So hand preference is only that you worry if they develop in the age of less than 18 months. If they don't develop after that, you know, as long as their fine motor is okay, you don't really worry about that.
Okay.
So it looks like, you know, she's not really doing much with a drawing.
What did you find?
And then obviously
What did you find?
you only try a couple of times. Kalau dia memang tak boleh juga,
Masih,
and then
Mas.
you go for next task. So what he's
What's
doing
in
was
the snail?
he moved away
Come on
from
over
the
here
pen
and
and
have a look
paper,
at this.
hide
Look
it,
at this.
and then get a new one.
What's that? Can you see this? Can you do that? Can you get that in there like that and go? Can you do that? What do you think?
Okay.
I think I'll present.
Yeah. So he gave up, which is fine. Okay.
Thank you.
Okay. Okay, Azwa.
You can have all the toys.
Okay. So this is the way that you're presenting your findings.
Who is a very playful little girl. I'd like to plot her height, weight, and head circumference on the appropriate growth chart. And today I examined her from a fine motor and speech and language point of view. With regards to her speech and language, she was able to understand when I gave instructions. She was able to understand my language. She was forming 2 to 3 word sentences. When asked, she was able to understand nouns. She was also able to understand verbs. The examination got a bit.
So when you assess the speech, obviously when talking about nouns, it's more about assessing the objects, ataupun what kind of objects, and then the verbs is what is the meaning or what is the purpose of the objects. So those are the different things that you want to assess. So as I say, objects, they can name objects by the age of 2. Normally 2.5, 3, they start to understand the purpose or the verbs. Okay. And obviously, you know, he complained about the child.
At that stage, but I would have liked to check if she was able to understand prepositions or adjectives, just to push it to her limits. But from that viewpoint, she was able to show a speech and language age of 18 months. In regards to her fine motor,
I would say she's probably about 2.
Very delicate piece of grip, which she demonstrated. Block tower. She was unable to demonstrate today a bridge, but she was able to show crisscross lines. This would put her developmental age with regards to her fine motor at around 18 months to 24 months. I would have liked to push her a bit further to see if she could have built a train. And I also would have liked to see how she would have done with much larger beads. I just didn't have at my disposal today.
If I tell you that Azamin's 2 years old, what would you explain to her mother?
I would explain to her mother that I'm not concerned about her thank you. her overall development, but I would like to assess her again to see how far I could actually push her, because I think that today she's just been very playful and hyper, and I don't think that was a true reflection of how far she could actually do.
And are there any other questions you would like to ask her mum or assessments you think would be relevant?
Yes, so with regards to her speech and language, I'd like to first of all know, was she born on time, if she was premature? I'd like to know if there's any neonatal complications, and then I would also like to find out how her audiology examinations were at the time of discharge from the hospital. In regards to her fine motor, I'd like to know if she has any visual problems, which I didn't elicit today, and also would like to know how she gets on at home with regards to mum. Thank you. With regards to mum giving instructions and how she does with her utensils at home with eating and drinking.
Thank you.
Okay, so those are the kind of way that you present your findings, and also you come to your conclusions. Obviously, we will ask you for the question, because as part of your curriculum, we teach you about neonatology. So when you come to the developmental milestones, you also want to know a bit of history, if you are allowed to ask history from the parents. So the thing that you want to ask is about the prematurity. Was she born premature, and was she born on time? If you was born premature, then you need to correct the prematurity by the age of 2. So if the child is 3 months premature and the child is now 18 months, so she is basically about 15 months old corrected age. Okay, and then you do the correct of age until about 2 years old. Okay, so if she's now 2 years old, then kalau dia memang premature 3 months premature, then her corrected age is about 21 months. So it's very important to know the corrected age, because if the child's supposed to do things at 2 years old but still not doing the things at 2 years old, the reason for that is because the child has not reached the age of 2 years old yet, because of the prematurity. Okay, and obviously assessing the child is like assessing you guys lah. Okay, sometimes you guys ada being naughty, ada yang and a bit your behavior, and so you need to be very passionate with them, and then the way that the candidates say to the examiners is that probably today she's not doing things that I asked her to do, because she's hyperactive, ataupun misalnya budak-budak Malaysia ni lebih kepada being shy, stress, anxiety, and so on. So those are the things that you can mention about, and then how are you going to assess, how are you going to tell parents in terms of what are you going to do to tell the parents in terms of if you find that the child is a bit delayed, what are you supposed to do? Okay, so in that particular case, you say to parents that today is probably your first assessment, so you would like to know the child more, you want to get more information, more histories, and then the best possible thing to do is to reassess the child again after 3 months. So hopefully that by the time you can assess her, you got the good rapport with the child, you can get rid of the stress anxiety at the time, and hopefully the child can perform better and can comply better with the instruction. Okay, so there's a 2 fine motor and also a bit of speech and language assessment. Any questions so far? Okay. Okay, so in terms of jargon, so the jargon is something that the child come up with, and it's only the people around her, the people close to the child know the meaning. Means that let's say if some sort of maman is either makan maman. So I'm not used to this childish punya ni. Let's say somebody says wa kiwi, so something that I made up. Okay, Okay, wakil so it could be that for the child is probably a toy ataupun maybe a wallaby kan, a wallaby. Kau tahu tak wallaby tu apa? Tahu wallaby? Wallaby ni orang New Zealand yang tahu. Aklan tahu kan? Aklan tahu kan? Hebat wallaby. Oh, ni orang rugby ni. So wallaby is apa? Apa wallaby? Hah? Small kangaroo, baby kangaroo, okay? Buat aklan orang New Zealand ni punya dia. Okay, so let's say if a child said wakiwi, which is referring to the small kangaroos, and it's only him that understand, and also the people around him, probably family members, parents mainly. Okay? So you as an assessor, you probably don't know that words, because it's a jargon for you. So by 18 months, they might have their own words of saying things. So normally maman ataupun apa she nasi jadi si ke kan. So those are the things that jargon they use, and only few people know close relative that know about the words. And you as examiners, you probably need to clarify that particular words with the parents, because the parents probably understand that words. So that's in terms of jargon that they use. The second question is about how many words. Okay, so what so as what the candidate says just now, dia tanya pasal object kan, which one is spoon, which one is duck, which one is carrot, and so on. And so those are the objects that you want to assess at the time. But in terms of numbers of words that they know, you probably don't know at that particular time. So what you need to do is you need to ask the parents. Boleh ask the parents. Normally mana agak-agak mak ayah berapa patah perkataan yang dia ada yang dia boleh cakap kan. So by 15 months, 18 months, you expect about 20 words they can say or they can understand kan. So those are, so you won't be able to assess at the time, but you probably just ask parents how many words in total that the child understand. Okay, another question.
Doctor, I would like to ask, how do you want to conclude if we found that when we assess that child, it got like different age for every aspect, like for the gross motor, for example, one of the aspect was very advanced, while the others was like backwards. So how do you want to conclude in that matter?
So you what you do is you always put that for the speech and language, the age is about 2 years old or 2.5 years old. For the gross motor is about what we say 12 years old, and 12 months old. So you always conclude by every domain. Okay. And then if you see a big difference, more than 6 month difference, if the child speech dia 2 years old, tapi dia punya gross motor dia 12 months old, and so there's about more than 6 months difference. So and then you will say that this is probably an isolated gross motor delay. Okay, in this particular case, I would like to assess further. So I would like to reassess the speech day again. I would like to complete the whole domain of developmental milestone, including the fine motor, including the social skills there. And then by doing that, you know that this child is isolated delay lah. Kalau dia ada more than one, it's going to be global developmental delay. So if the difference is only about 3 months, yang mana 2 years, and then the other one is about 21 months. So that's probably not a big difference, which is fine. Okay, because you need to consider the factors in terms of whether the child is compliant or not, whether the child is ada anxiety ke, follow instruction ke, or maybe dia masuk hospital because tak sihat and so on. So you need to look into that factors before you come to conclusion. So assessing the developmental milestone is the best way is to do it when the child is relaxed, when the child is very happy and comfortable with the environment, and the child is well in themselves, not when they are unwell. Okay, so you cannot put the conclusion by that point immediately. For the sake of examination, you can say lah domain gross motor macam ni, speech macam ni kan. And then if this is true, then it could be that this is isolated delay kan. Cuma you cannot say is that because you still need to assess the whole the whole 4 domains to come to the conclusion of isolated ataupun global developmental delay.
Okay, thank you, Doctor.
Okay, another question.
Doctor, I have question.
Mhm.
So in the developmental assessment, when should we worry and when should we not worry during our assessment? Is there any like macam warning signs ke?
Okay, so you worried when you are not be able to do the developmental milestone. Okay, that's when you worried. Okay, 2 seconds.
Waktu salat asar akan masuk dalam tempoh 15 minit. Sekarang adalah kita bersama-sama menunaikan solat di awal waktu dan Nabi Muhammad SAW menyampaikan, apakah amalan yang paling terbaik? Lalu baginda menjawab, solat di awal waktunya. Untuk maklumat, solat fardu boleh dilaksanakan secara berjemaah dan SOP yang telah ditetapkan. Dan terima kasih.
Okay, so the red flags is when you have you have a delay more than 6 months. So those are the red flags. Okay. However, gross motor delay is quite the weightage there is much more compared to others, because if you got gross motor delay, most likely is going to be neurological pathologies if there's gross motor, meaning that if you got a 2 years old who's still not be able to walk, then you start to worry. Okay. Ataupun somebody is not walking by 18 months old, so you start to worry, compared to the one who's not be able to speak any words at the age of 3. Okay, so speech delay is quite common in boys. Okay, and so if you got a child that's not speaking by 18 months, it's probably you can still wait until about 2 years, 2.5 years, and obviously by 2 years, 2.5 years, if they're still not speaking any words, then you probably refer to the speech therapist, or you start doing the assessment for the autism and so on. So it's all depend on the weightage of your physical findings ataupun your developmental findings, especially for the gross motor. So that's the main thing about developmental milestone. If somebody not walking by 18 months, you start to worry. If somebody showing sign of hand preference at the age of less than 18 months, then you start to worry. So rasa dalam PITS protocol ada red flags of things that you want red flags about developmental milestone. If somebody's part of the fine motor is vision, and so if somebody not fixing and following by the age of 6 to 8 weeks, or not smiling by the age of 6 to 8 weeks, then you start to worry as well. So that's you want to see whether they got any visual problem or something else. So there is a red flags that you need to know lah. So and then there are a few more red flags in the PITS protocol that you can read about as well. Okay. Okay. Another question. So
I have a question. We do worry if there is any delay or regression. So what about if the child is too advanced of their age? Is it worrisome or is just something that we need to be grateful for?
Okay, so this is all ethical problem ni. Siapa cakap ni? I cannot see who's speaking just now.
Mimi, Nadia.
Okay, Nadia. Okay, you're just not coming out. Okay, fine. So I think kalau dia very advanced, you don't need to worry lah kot, very advanced. Because some children macam hyperlexia. Pernah dengar the word hyperlexia? Meaning that let's say hyperlexia by definition is the development of ability mainly about recognizing numbers, symbols, recognizing things, at a very early stage. For example, macam bercakap ataupun membaca umur 2 tahun, mengira by umur 2 tahun. So those are hyperlexia. Hyperlexia, we say about 5 to 20% of hyperlexia is associated with autism ataupun ADHD ataupun Asperger's. So So you need to mana dalam domain fine motor, gross motor, speech language and also social, you need to see which one is interconnected kan. Kalau nampak macam dia punya fine motor dia very good, memang advance sangat, tapi in terms of dia punya social skill dia quite delay, quite mana not as advanced as the fine motor, then you probably need to think about autism at that time kan, ataupun Asperger's. The thing is, autism normally all the signs normally come up by 3 years old. So by 3 years old, you can see the sensory dysfunction, you can see the social disabilities and so on. So cuma itulah, hyperlexia is one of the things that is quite common in autism lah. Cuma kalau all the domains looks okay je, walaupun dia 2 tahun tapi dia punya domain fine motor, gross motor, speech and language, social dia macam 3 tahun, then you shouldn't be worried because they are all macam berjalan seiring kan, seiring dan sejalan kan, dia punya all the domains kan. Okay, so you don't need to worry if they are advanced, tapi all domains are advanced, not just 1 or 2 domains yang advanced. Okay, cuma kalau advanced sangat, it's fine. It's just that you tell the parents that you just need to reassess again dia punya developmental milestone every 6 months ke. Just want to make sure that you don't worry about pathological punya problem macam CP and so on. You more worry about some sort of syndrome yang macam tu lah, yang macam ADHD ataupun autism ke, something yang tak nampak physically, but only can be detected by doing the developmental milestones.
Thank you, Doctor.
Okay, fine. So I'm just going to show you the last one. Let me see.
Okay, Rachel, welcome.
Purple taxi, is it? Okay.
Welcome to your development station. Thank you. This is Jack, and I wonder if you might be able to assess all 4 domains of development. Okay.
Because if you're not careful, it makes
So, hi,
holes in the
Doctor. I'm
paper.
Rachel. I'm one of the doctors.
Hi, Rachel.
Thank you.
This
Hi,
is
Jack.
Rachel.
I'm Rachel. Thanks very much for letting me examine Jack.
Doktor,
Sorry, Dad.
tak nampak.
You're starting with some drawing.
Tak nampak yang Doktor share.
Tak nampak pula.
Ha.
Tak nampak Let me see. Mungkin sebab internet kot. Kau nampak ni, this page kau nampak?
Nampak.
Ni.
You might be able to assess all 4 domains of development.
Okay, nampak semua?
Nampak dah.
Okay.
Okay.
Because if you're not careful, it makes
So, hi,
holes in the
Doctor. I'm
paper.
Rachel. I'm one of the doctors.
Hi, Rachel.
Thank
Jack,
you.
this
Hi,
is
Jack.
Rachel.
I'm Rachel. Thanks very much for letting me examine Jack
No
today.
problem.
So, Jack, you're starting with some drawing, are you? Can I see what you can draw? Well, you've got a nice palmer grasp with that pen. And do you think you can draw a circle for me, Jack? Let's see if I draw one. Oh, you can, all by yourself. Brilliant. And do you think you could draw a cross like this? Can you do that? Yeah,
Oh,
nearly. Try one more time. Like that, and then like that. Yeah. One, that's it. Good job. Brilliant.
Well
yeah.
done, Jack.
And now let's see if you can do this. Can you draw a square like that? Yes. Brilliant. Well done, Jack. Now, seeing as you were so good at drawing, I'm going to take it away now and we're going to do something else.
should we play another game?
Another game. Can I have the pen? Good man. Right. Now, this is a tricky one. I want to see if you can make a tower, okay? And how tall a tower can you make?
Can you make a big tower, do you
A
think?
really, really big one. Okay? Your turn. Go for it. You can use any color you like. There we go. What color is that? Wow, you know your colors. Yeah. What color is that? Orange. What other colors have we got? Oh, you can make a big one.
Let's bring the mouse with us.
Yeah.
Right, yes.
Oh, you're very good at this. Look at that. And the last one? Brilliant. Let's count. Can you count?
1, 2,
12. Brilliant. Well done,
Well
Jack.
done.
Let's put them all here now. Let's try a few things, okay? I don't think we've got scissors or anything else for fine motor. So we'll move on now. I want to see if you can, you listen carefully, I want you to put this on your head, okay, wait a second, on your head, and then I want you to touch your foot with it, and then I want you to give it to Dad. Do you think you can do that? On your head, and then what was next? Let's try it again. So I want you to put it on your head, and then I want you to touch your foot.
So what she's doing, she's asking for 3 steps instruction, okay? And then when you give it this three-step instruction, you need to give at one point only. So putting the thing on the head, I cannot follow the 3 steps. Okay, oh dear. So 3 steps, put it on the head and then touch with the foot and then give it to Daddy. And so there's 3 steps there. But she only need to mention once so that and then make sure that the child is paying attention when she mentioned that. And then when the child is doing it, she cannot basically give another instruction, because if she's giving another instruction, then she's going to go down to 1 step instruction. All right. If I say to you guys, Aklan, okay, ambil cawan, letak air, minum. And so I need to just say once, and then Aklan pun ambil cawan. Lepas tu dia macam blur, macam ada absent seizure kan. Lepas I said to him, letak air. So if I'm doing that, that means that I'm giving him 1 step commands only. Okay, so you need to give the 3 step all together at one point, and then the child start doing it, and then you need to leave the child to complete the task, the 3-step task. Okay, so normally you're doing this at the age of 3 to 4.
With it. So head and then foot and then give it to Dad. Can
Okay.
you do that? Head and then. Brilliant.
Jack, can you have it touch your head with the brick, then touch your foot, and
You
then
can
give
take
it
it
to Dad?
off your head
Yeah,
first.
then
Yes.
foot,
And
then
foot,
head, foot, and then give
Dad.
it to me.
Can you do that? Well done.
Yeah,
Brilliant.
well done.
So it's taking a bit more time for the
next
child
thing we're
to
gonna
understand
do
that the whole instruction.
Is it?
Can we see how you are with your body parts? So can you show me where your nose is and your ears
Yeah.
and your knee? I think that's far too easy, isn't it? Okay, now let's see what you can do. Can you tell me what this is? What's that?
Say the words.
No. You don't want to do shy? Okay, we'll not do that then. Okay, so the next thing I want you to do is, can you take this and can you put it on top of that step? Okay, I want you to put it on top of that step.
The brick. Can you put the brick?
Yeah, on top. And now can you put it under? Can you put it under the step? Under the step. Brilliant. So
Well
it's got those
done,
proper positions, right?
So this is just assessing the proposition. For proposition normally by I can't remember 3.5 4 kot proposition. Mana di atas, di bawah, di luar, di dalam, and so on. So proposition about 3.5 4 years old. Okay.
Nicely. Okay, Jack. Next thing. Now, seeing as we're up playing, can I see you jump? Can you jump? Oh, you can. Can you stand on 1 foot? Can you stand on 1 foot? Shall I hold you to see if you can do it? Oh, now if we come out into the middle of the, can we come out into the middle of the room and see if you can stand on 1 foot by yourself?
Let's take the pens.
We better take those away. Can you stand on 1 foot by yourself? 1, 2, 3, 4. Oh, you can. Another one. 1, 2, 3. Get the end. 1, 2, 3, 4.
No, we do it once. Just do it once, as long as you can. 1, 2.
Yeah. That
Oh,
was
and
good.
jumping as
Good
well.
job. Okay, and whenever Jack goes upstairs, how does he go up? Can he go up and down by himself one step at a time? Or does he go?
Yes, but we find his concentration on coming down quite poor. So we have a no talking rule, and he did fall down a few months ago, didn't he? So it's just, I think it's concentration.
He does do
You can physically do it.
Yes.
That's brilliant. And is it okay if I just ask a few questions? So does he feed himself?
Yeah.
So what she's doing is she's asking questions. Okay, the reason for this is because of there's probably nothing else in terms of in this room there is no stairs or there's no steps, so you cannot do assessment of the steps unless you got the equipment. So there's no equipment for assessing the steps or climbing up the stairs. So you have no other way to assess it apart from asking the parents. So you need to ask the parents how he's climbing up the stairs and how he's coming down the stairs. The other thing is in terms of whether he can ride a tricycle or bicycle. So those are the things that you can ask parents about that. So it's still considered as assessment.
Used to feed himself. At the moment, mostly a spoon.
Yeah, spoon, and his hands a lot as well.
Okay, and can he? Is he toilet trained? Is he potty trained?
Not for bowel movements, and really, we've always said, okay, you need to sit on the potty. Whereas lately, we've been trying to get him to actually take the initiative and go, but he just says he's too busy. So we do.
So we've had a few little leakages. We don't have major.
Just a little spot. Really.
And wear nappies or
no.
Okay.
Only night time and for bowel movements. He has a nappy. He tells us, and we put a nappy on for bowel movements.
Okay. And I think this is down to he had oral thrush, which went right through him, and we had a real problem getting rid of it. We had it for about a year. And so when we first concentrated him, he was doing bowel movements for the first couple of weeks in the potty, and then he started saying his bum was sore.
Okay.
I think it's psychological
that's
now.
kind of affected it.
Yeah.
Okay.
Well, I think it's improving because we're lowering the salinity he's on, which seems to be stopping the flush going straight through, which we think is coming from a steroid inhaler.
So from a motor point of view, I'm guessing that he can run.
Yeah.
And he can obviously jump really well, and he can stand on one foot for a few seconds and see climb. That's great.
Yeah.
And then from a fine motor point of view, he's built a really big tower, and he can draw a circle and a cross, but not quite yet a square.
We are working, if we position the pen correctly in his hand and stuff, we have started getting him writing numbers at home, just kind of tracing over.
It tends to be smaller pencils. So it's the longer ones he then holds like a fist.
Like
smaller ones he then uses his fingers more, which you can then get better detail.
So this is a very important thing as well, because the longer the pencil or the pen, it's going to be difficult for the child to hold. Because if somebody who actually already developing the mature tripod pencil hole, if you got a very big pencil, sometimes the weight of the long pencils make them a bit difficult to control, because you need to understand your physics, and so you got the lever, you got the physics, and so sometimes if there is a weight on the long pencil, sometimes it's difficult for them to hold the pencil. So it's better sometimes to use the crayon, because crayon is quite small and short, so that they can hold the crayon properly if they are already developing mature tripod. So in this case, what is the clinic doing is just try to do everything. Maknanya dia buat fine motor, gross motor, speech and language, and also try to do the social as well. So asking about day by toilet training, asking about the way that he eats and so on. So those are the short. They buat everything in 10 minutes. Okay, which is a lot, and sometimes you can only cover everything within 10 minutes.
From a talking point of view, is he making sentences? I haven't quite got him to chat to me yet.
He's quite good at sentences, but the pronunciation of the words themselves can be quite poor.
What's your school called?
What nursery do you go to? No,
does he know what it's called?
Yeah. No, you'll be going to big school soon, but where do you go to nursery?
What's the name of the nursery?
Oh, you bet. Cool. All right, well, that's my time up those little things. So now I'm just going to summarise my findings to Hannah.
Yeah.
Thank you very much, Jack. Okay, so I've examined Jack from a developmental point of view. From a gross motor point of view, we could see him running today and jumping, and he managed to stand on one foot for about 3 or 4 seconds, but not for longer than that. And I didn't demonstrate him hopping actually. So that would put him at a gross motor development age of at least 3.5, but not quite 4. From a fine motor point of view, he was able to build quite easily a tower of 12 and might have even been able to do more if there'd been more blocks. He was able to copy across, but not really, at about 3.5 and not quite 4. From a speech and language point of view, he clearly knew his colours and he could count to 12. Mum did tell me that he can make sentences, although I didn't really demonstrate that today. And he clearly knew his body parts well. So that would put him being able to count again around 3.5, 4. And from a behavioural point of view, he's not quite out of nappies during the night time, but he's dry during the day. So that's 3, and he can feed himself, which would be at least 2, 2.5. Putting it all together, I would estimate him to be around 3.5.
Okay, so it's just an example of how to do things, how to assess. Regardless of whether you are undergraduates, postgraduates, medical officers, specialists, consultant, and so on, the way that you do develop the milestone is the same. It's not going to change much. It's the same thing, regardless of what levels you are. Even the videos is about a membership exam for MRCPCH, but the way of doing things is still the same thing. It's not going to change. The way I'm doing it, it will be the same of the way that you guys are going to do it. Okay, I'm not saying I'm the best person to do it. It's just that the way, this is just a scheme how you're supposed to do developmental assessment. Okay, I think that's all. I got three. Yes, 3. Is it 3? Yes, 3. It's only 3 videos, but those videos you can find on the YouTube anyway. It's just that for you to nak ambil ad hoc skate for you to gain the skills. But the main thing is about playing with the child. Okay, it's not that you assessing the child. You assess while playing with the child, and the main thing is about playing with the child, because by playing, then that is the best way how you will get the attention and also the focus for them to do the task. Okay, the more equipment that you have, the better. However, you only use one equipment at one time. Okay, do not confuse the child with many toys at the same time. Okay, so I think that's all. Any question you want to ask? Orang lain?
Sorry, boleh nak tanya lagi? Okay. So for younger child, how actually we want to demonstrate the palmar grabs and the pincer grabs?
Okay, so the palmar grabs, for palmar grabs, you just use any big things, macam anything that is quite big in terms of you can use pencils, you can use the cube itself. The cube itself is quite big for them to hold. So palmar grabs is depend on what kind of what part of the hands that they are using. Are they using the palm itself, or are they using the fingers to pick it up? If they're using the fingers to pick things up, then most likely they will have a pincer grips. Okay, so what you do is you try with the big cubes and see how they hold the big cubes. So if they're using the palmar to grasp the cubes, then most likely they will have palmar grasp. Okay, but if they're using the fingers to hold to pick up the cubes, then the next thing you want to do is you want to see whether they can use the 2 fingers, the thumb and the index fingers, pointing fingers, to pick up small things like button or coins. Okay, or if the best one is racing, if you can ask them to pick up the racings. Okay, but the same thing as well. You still need to assess both palmar and also the pincer grips. So the best way to do it, you need 2 things. You need to have the big object, for example, big cubes, and then the small objects, button, coins, or racings.
Okay, thank you.
Some child at the age of 8 months, they can pick up hairs kan. Nampak hairs dekat hujung laci ke hujung almari ke, they pick up hairs, very small hairs on the floors, and they pick it up and then put in the mouth. And so sometimes anything lah. My daughter tend to pick up the ants, semut yang kecil-kecil tu, yang warna hitam semua tu. So she pick it up and then normally into the mouth, because at that time, at this age, they are mouthing. So, okay, I'm sure that you guys not picking up ants semut masuk dalam kecauan yang minum kan. Okay. Anything else? Any other question?
Doctor, I would like to ask regarding
Apa cakap ni?
regarding the pincer grass.
Okay, sorry, who are you?
Me. Hanani, Fitri Hanani.
Okay, fine. Okay. Sebab
So
yang keluar kat skrin saya ni Dahiyah je, tak pernah orang lain.
Okay. So, I would like to ask regarding the pincer grass. So, how do you want to identify if the child is having like immature or mature pincer grass? So, is the mature defined as when the child pick the things using the thumb and index finger? Is that true?
So the mature pincer kan, you're talking about pincer graph, okay? So the pincer graph is tip to tips. So you basically looking at the tips, dia punya movement dia mana. I need to find something for you to see. Yeah. Tak ada coin tak ada. I need to find something. 2 seconds. Okay. So cari semua memang tak ada nanti. Oh, gurau kan. Okay, fine. So if you got things there, so the mature pincer graphs is basically you need to use the tip of the thumb and also the tip of the pointing fingers. And so by doing that, and they play at the very edge, at the very tip of the fingers, finger objects. So those are the mature pincer graphs. And then you got children yang baru develops the pincer graphs. So they normally come with they normally involve their digits to pick things up. So macam dia pakai dia punya digits, macam dia punya the interphalanx phalanx kan. So they're doing that, then pick things up. So they are involving their not really the tips but the whole fingers to pick things up. So normally kalau macam yang baru, yang just a new one to develop the pincer grips, they will go like that, and then develop and then pakai the not the tips but the phalanx of the fingers ataupun digits of the fingers. So those are the immature ataupun newly developing pincer grips.
Okay, thank you, Doctor.
Assalamualaikum, Doctor. My name is Zafira. So I have questions about. I just want to clarify something. If the child able to give names and the colors, however the others phrases like macam if like 2 years old punya speech punya ni, like 2 years old, like he only knows how to give names and color. However, the rest macam like the body parts he cannot point to body parts. So what the confusion for that child?
Because your pitch protocol says by the age of 2 they know like 3 body parts. By the age of 3 they know about 6 body parts. Age of 2 they should know about 3 primary colors, and then age of 3 more than 6 colors. And so those are the guidance that be given by the pitch protocol. Okay. What you can mention to your examiners is, let's say if the child can 2 years old should be able to name 3 body parts, and also you should know about I should be named 3 body parts and should know at least 3 primary colors. And so if the child only can mention about 3 body parts tapi only 1 of the colors, that still put them 2 years old anyway. Cuma you just want to mention to your examiners. However, the child not be able to name 3 primary colors as expected. So in that particular case, that you still put the child as 2 years old. However, you probably want to reassess again that about primary colors and so on. Betul ke? Itu soalan dia ke soalan lain? ke macam faham lain?
I mean that if like the speech delay is macam like one is like 3 years old punya speech and then the rest like 2 years old.
Okay, so you always pick up the advanced one. You don't pick up the lesser one. Okay, because if the child only can mention 3 body parts, tapi dia bercakap putting 3 words together, then you should put the 3 words together as the most advanced punya achievement. You don't pick up the lesser one. Those are in terms of a particular age lah. Itu depending on the domain. But if you're talking about speech and then you're talking about gross motor tu lain, speech lain. So you still pick up the better one, the most advanced one. Cuma sometimes you need to be very sure that is it really 3 words per sentence or is it just tak nak is basically could be 1 word sebenarnya. It's not really 2 words, kan? Unless kalau dia kata saya tidak mahu because because our language is quite short term language, being shortening language, not really a proper language. Kalau macam English, they don't really have much short abbreviation bila cakap kan. So compared to Malay punya language, but most of the time you choose the most advanced punya skill rather than the lesser one, because that probably the achievement that they have. Cuma when you find the lesser achievement, it could be because of the day, maybe dia punya performance on that day is not not well because of the anxiety and so on. So that's why you go for the most advanced achievement.
Thank you, Doctor.
Okay, any other question?
Doctor, I have a question regarding sound localization. In 3 months, you mentioned that on the level 6 months above and at the 9 month below. May I ask, how do we assess the sound localization? Like, do we like whisper to them at different level or?
Like kalau macam 3 months, basically it's more about the rattle kan. The rattle it is something not that easy to do. Kalau nak beli 3 months, you do the rattles. When you shoot the rattles, you shoot the rattles behind their ears, maksudnya behind their head. Okay, but 6 months, if you shoot the rattles below the levels of the ears, sometimes they don't recognize it. So that's why they go for higher one. So 6 months is if you go higher than the ears, they can hear. The 9 months, if you go for 9 months, you can hear the level, same levels, slightly higher levels, and also the behind below the levels. So those are the things. But normally you don't really assess them. You just assess their hearing by just rattles behind the ears, and then if they turn, and they are okay. But you need to know in terms of the specific details. Maknanya kalau 3 months, and they can hear the rattles same levels, 6 months slightly higher levels, 9 months slightly lower levels. So those kind of things. But we don't really expect you to do it anyway, because assessing the higher levels, same levels, lower levels is much more complicated than just checking the rattles. Okay. All right, the rest of you, okay? Nothing else?
Doctor, I have another one question. After we assess the child and then getting the history, we found that the child have a developmental regression. So what we should do next? Should we follow up after 3 months or any urgent?
Okay, so depend pada dia punya ni lah, regression dia. Because regression, you only need you know the child is regress because you already know dia punya higher limit dia. Okay, dia punya higher limit dia, you already know the higher limit. So if there is any regression and the regression is quite marked, mana more than 6 months, if the child was able to speak normally before, and then suddenly the child only speaking in 1 word per sentence, there's a marked regression. Okay, so if you got a 3 years old who was speaking 3 to 4 words per sentence, and then suddenly just only speaking one word per sentence, then there's a marked regression. From 3 years old goes down to 1 year old. So there's a marked regression. In that particular case, you want to make sure that the rest of the domains need to be assessed as well lah. Maknanya fine motor, gross motor, and so on. Okay. This could be normally CNS punya pathology. So is it the infection, metabolic condition, inflammatory conditions, sometimes it's a syndromic condition, and sometimes it's epilepsy. Sometimes you can have, we call it speech aphasia due to Landau Kleffner syndrome. So sometimes it's just part of the non-convulsive epilepsy or non-convulsive seizure, means that the child's not speaking as normal, tapi tak ada jerking movement. It's just that there's a seizure happening in the brain with no clinical seizures. It's just a non-convulsive seizure, which is difficult to diagnose, because it can only be diagnosed with EEG. Okay. In that particular case, if you got regression, normally you treat the regression. You want to investigate very well, urgently kalau boleh, because if this is seizure, then you can treat the seizures soon. If soon, maknanya you need to give IV phenytoin ke phenobarbital and so on. If this is infection, then you need to treat infection. For example, if you got encephalitis also can come with regression as well, especially speech regression, and sometimes confusion. Kan? So if you got a 3 years old who was speaking well, and then suddenly memang muted, kan? muted total mutism ataupun absolute mutism, then you worry about encephalitis. Yes, I would say cumanya you need to know what is their advance, the maximum achievement that they have. So normally the maximum achievement coming from parents lah. So parents akan beritahu, normally dia bercakap macam biasa, cuma sekarang dia macam behaving dia quite withdrawn ke, not speaking at all ke, looks confused ke. So those are the signs.
Doctor, we have to admit the patients.
Oh, in that particular case, I will admit the patient lah. And because you don't know what is the cause, as I said, because kalau infection and also seizure, then you need to treat it urgently lah. Kalau dia metabolic, sometimes you also need to treat urgently as well if it is metabolic. Kalau it is syndromic, sometimes it takes time. So you probably need to treat symptomatically and also based on your investigation findings. Okay. Okay. Anything else? All right. So if there's no question, then thank you very much for attending the session. Obviously, it's not a ideal one to do a developmental milestones, and obviously I suppose there's 3 groups, 3 different sessions. You got one group, one session, second group another session, third group another session, and we're doing it physically. Mana kalau buat practical, we go to HTA and then see patient and doing it with patients. So because of the PKP and so on, so this is not an ideal way to teach developmental milestones lah. But we got what we got lah. So hopefully lah, kan? Hopefully we don't really pressure you on developmental milestones lah. Okay, but once kau dah masuk hospital nanti, do try and assess patient. Okay, do try do a developmental milestones. Okay, especially for those yang from 12 months to 3 to 4 lah. So get the range, 1 year, 2 years, 2 to 3, 1 to 2, 2 to 5. Normally they think that we 1 to 2, 2 to 3, 3 to 5. So those are the age group yang we get you. Cuma as a person who prepare the developmental milestone station or developmental milestone punya patients, okay, we tend to take a patient less than 2 years old. Okay, faham tak? Faham? Okay, faham kan? Faham? Okay. Okay, fine. All right, so no other questions. So thank you very much for coming. This is officially my last day in UIA, but obviously I'll be doing the online teaching with you guys when I'm away for the next couple of years. But thank you very much. We'll see you when I see you, and all the best. We're going to adjourn our session with for someone else. All right, thank you very much. All right, Assalamualaikum warahmatullahi wabarakatuh.
Thank you very much, Doctor.
See you, Doctor.
Thank you, Doctor. Thank you, Doctor.
Doctor.
Doctor.